lines he finds as he goes around. He does home health, physical therapy in people's homes, and so I see this. I know we've all experienced it. We all see it, and we want to address some of that today. Employers throughout the state are having a difficult time keeping their businesses open as staff become infected with COVID-19. This includes our schools. Our schools are obviously having a real struggle right now as well. We're struggling not only to keep kids in classrooms, but to keep teachers there. Over the past 36 hours, the governor and I have been working very closely with legislative leadership, with the speaker and the president, and health leaders and Superintendent Dixon. And collectively, we've determined that our response to COVID-19 right now needs to change as the virus has changed. We're dealing with something different now. We need new strategies. And so today, we want to present our plan to you, our plan to deal with the current situation as Omicron tears through our community. First, we're going to hear from Governor Cox. And then we will hear from State Epidemiologist Dr. Leisha Nolan, and then State Superintendent Dr. Sidney Dixon. And finally, we will hear from House Speaker Brad Wilson. I'd like to excuse President Adams. He feels bad he can't be here today, but I would like to acknowledge Senator Cullimore here representing the Senate, and grateful to have his presence. Governor Cox.
Thank you, Lieutenant Governor. Ladies and gentlemen, we appreciate you being with us this morning. We appreciate members of the media who have been our partners in helping to get information out over the past 2 years with this pandemic. So, as the Lieutenant Governor mentioned, and I'll share just a few data points of which you were all tracking very closely. Average daily case counts since Christmas Day. We'll use that as kind of a baseline. Basically, Christmas Day is when we started to see Omicron overtake Delta and started to see these big spikes as every state has seen. Average daily case counts since Christmas Day are up from about 1,200 a day to more than 9,500. The percent positivity rate has gone from about 13.2% up to 36.5%. The number of hospitalized cases has gone from 434 on Christmas Day to 638 yesterday. And cases among school-age kids has increased from about 150 per day at Christmas time to about 3,000 yesterday. So daily tests have increased from 19,000 to almost 48,000. Which is why we're here and having this conversation. Of course, we've all seen stories in the media or from our friends of the sometimes hours long wait to get tested. The COVID-19, as Lieutenant Governor mentioned, the virus has changed significantly, and this Omicron variant. I'll talk a little bit more about that in just a second. But as we knew we were heading towards Omicron, and what's interesting about this one too is not just how fast it spreads within the community. I'll talk about that more in just a second as well. But how fast it is spread across the country. With other waves, of course, we've seen it start on the coast usually and kind of make its way in over the course of a month or so. In this case, much more rapidly. New York and Washington, D.C., where we saw the first exponential spikes, we're only a couple weeks ahead of Utah. And that is true, again, of most states that are seeing the same types of numbers that we are seeing now. And so as we met with our teams, and I so want to thank our health departments, our local health departments, and our partners who are in the testing business, helping us to get people tested. And we knew that we could increase the number of tests from what, an average usually in normal times around 10,000 a day, in Delta, we were getting up to 19,000, 20,000 a day and a little more than that. We knew we could get up to 45 to 50,000 tests a day. So we could double that capacity or triple that capacity. But we knew after that it would be difficult for a couple of reasons. The biggest reason is just personnel. We're very blessed in this state to have an unemployment rate of 2.2%. But as you know, in every single industry, we're struggling to find employees, and that is true in testing as well. So we knew that we would have a capacity strain when it came to personnel. Our plan to make up for that was to use home testing kits, so that when lines got longer, we would use those home testing kits for people so that they could go home, test, find out if they were positive, and then take the appropriate steps to quarantine if they were positive. And so we had an extra supply of home testing kits, and that's what we were doing. It worked very well. When lines got too long, we would use those home testing kits, and lines got shorter, and people were mostly happy. And then something else changed there. So not only do we have a personnel shortage, but there is a testing shortage. The normal supply of tests that we had already ordered did not come to us, and so that became another constraint, and that is what has led directly to the longer lines. Now we are hopeful that our back orders of tests will be coming in, and that over the next week or two, we'll be getting hundreds of thousands of the tests that we have ordered. And so our fingers are certainly crossed. But in the meantime, until those tests come, we have to look at things a little differently. And so we challenged our health officials and to advise us, to give us the best data they could on testing, and what we should do, how we should approach this moving forward. I would also note that what we heard from them, and Dr. Nolan can speak to this much more and talk about the recommendations that they are giving to us and to us collectively as Utahns, is that the very nature of testing, I think it's important to remember, we don't do this type of testing with really any other diseases, right? We get sick, we stay home, hopefully, and hopefully we'll do more of that. That may be one of the positive lessons that comes out of this. And then if we're not getting better, we go to the doctor, and then they test us there to see what we have, and then they give us the appropriate medications to deal with that. That's how we normally do this. However, the reason we do this mass testing, the idea behind that was that we test people, we find out if they have it, and again, with the original virus and Alpha, the first variant, there was a delayed time frame for this to develop within people and then be passed on. So if we could test you quickly when you had symptoms, we could find out if you had it, then we could contact the people that had been around you in the last few days, and we could help them to isolate as well, so that we could slow the spread and we could stop the spread. Now, what's different again, and we're still having alpha fights in an Omicron world. Omicron is very, very different. The disease is much more transmissible, much more contagious. So basically, if you look at the studies, alpha was 2 times more contagious than the wild. Delta was 2 times more contagious than alpha, and Omicron is 2 to 4 times more contagious than Delta. And as humans, we're not really good at processing exponential growth. But what we do know, there was a study done in Japan about Delta that basically we were shedding with Delta 1,000 times more virus than Alpha. That's an enormous change, right? Now, and that made it 2 times more contagious. So we're looking at 2 to 4 times more contagious with Omicron. Now we're talking about exponential, millions of times more virus that we're shedding with Omicron than with others, which makes it just, again, so explosive and super contagious, and makes it much more harder to contain. It also moves through us much more quickly. So instead of taking 6 days from contact to actually getting symptoms, now we're talking 2 days. So by the time people are getting tested, they've already infected a whole bunch of people who have already infected a whole bunch of people. And our ability to contact trace with numbers like this is just virtually impossible. And so that changes the value of testing. Now there is some good news. And the good news is that we have much more data about Omicron and its effect on people. And so what we do know, some new numbers came out yesterday that said that if you control for everything else, you control for vaccination, you control for previous infection, you control for all of those things, it looks like Omicron is 25% less severe than Delta. That's really good news, right? That's good news. But we also have so much more of it. Now, the other good news, though, is that we have many, many more people vaccinated. Close to 70%, well, a little more than 70% of Utahns 12 and older are fully vaccinated. That's great news. That's what we didn't have with prior versions of this virus. We also have more people that have had other versions of this virus. And so all of those things are helping to lower hospitalizations and lower deaths. We also know that with Omicron, it tends to be in the upper respiratory system much more than in the lungs, and that we're seeing here in Utah. We talked to some of our hospitals yesterday to get an update on them, on what they're seeing on the ground, and they said, well, the good news is that most of our ICU patients right now are leftover Delta patients, people who had the Delta variant, and they had to go to the ICU and they're staying much longer. They said we are seeing also what we're seeing nationally, and that is people with the Omicron variant, their stays in the hospital are significantly shorter. There was one study that was done a couple of days ago that showed that the average Delta stay was 4+ days. The average Omicron stay is a day and a half. So that's good news because our throughput can get much. We can get through more people in the hospital, get them out, get them healthy, get them back on their feet. So that's also very positive news. Now, the downside is that there's just so much more of it. So even if the per case rate of hospitalizations is significantly lower, which it is for all of the reasons I mentioned, the raw number of people getting hospitalized is actually higher because there's so much of it. Now, we do have hospital beds, and again, our ICU capacity is not being taxed with Omicron the way it was with Delta. The problem is, as I mentioned, because this is so much more contagious, and because traditional measures to prevent the spread of this variant don't work as well, many more of our nurses and doctors and those that work in the hospital system are also getting this, despite mask wearing and all of those other things. They're catching Omicron, which means that they're out for 5 days, and that leads to staffing shortages. So I think it's just important that we understand, again, the changing nature of the virus, what's different about this one versus others, and how we can protect ourselves. Now, the last thing I want to say about that, and this is the best news of all, and that is that while we've looked across the country to see if other interventions are working, and we can't find that other interventions are working the way they have in the past, what we do find that is working are vaccinations and booster shots. If you look at our hospitals in Utah and across the country, people who are vaccinated and people who are boosted are not going to the hospital in nearly the numbers. It's a very small fraction of the numbers of those who are unvaccinated. And so when we are looking at something that works against Omicron, that will protect you from severe illness, from being hospitalized and dying, it is still vaccines and boosters. And we greatly encourage you to do that. Now, the last thing I'll mention before turning it over to Dr. Nolan, we are seeing this spread through our schools. And those same limitations that we have on staffing and the number of tests available impact us in our ability to deliver tests in our Test to Stay program in schools. My own daughter's class had her school had a Test to Stay event a couple days ago. She messaged me and said, "Hey, the good news is I tested negative. The bad news is for any of you Marvel comic fans out there, it was a little bit like the Thanos snap." She said, "We did a Test to Stay event, and all of a sudden half my class was gone because they had tested positive." We're seeing this in schools that have masking requirements as well as schools that don't. This severe spread is impacting all of our schools, and it's also impacting our teachers as well, our educators, and making it hard for them when they test positive and have to quarantine for 5 days. So this is very serious, and so we also tasked our public health officials to come and give us their best recommendations on what we can do in schools, given the fact that we have limited tests available and we have a limited staffing for that to happen. I would just note that the recommendations that we're getting are the same recommendations that are happening in states all across the country. I've been talking to fellow governors. We've been talking to fellow public health officials in the West, Intermountain West, and elsewhere. Had a great conversation with a couple governors yesterday yesterday in Arizona and in Arkansas, and they're having these very same conversations and receiving similar recommendations. And I'm so grateful for the leadership of our public health officials. Dr. Nolan, who you haven't seen as much, who came in for Dr. Dunn when Dr. Dunn went to Salt Lake County. She has been a tremendous resource and filled those very large shoes that Dr. Dunn left behind. I want to thank everyone at the Department of Health, Nate and his team, who have worked so hard to continue to advise us through these difficult times, and to all of those who are working in public health, all of the doctors, the nurses, those who are running testing sites. Thank you for your diligence. We know that Omicron comes down as fast as it goes up. We're hopeful that in the next couple of weeks we will reach our peak, as New York and DC and those other states have done, and are heading back down. But until then, we're going to get some additional recommendations on how we can get through this testing crunch and get us through the next few weeks. So with that, I'll turn the podium over to Dr. Nolan.
Thank you, Governor Cox. And thank you all for coming to listen and hear about these advisements. So there's two main changes that we're talking about today, and these are temporary changes, but I think things that are really important to affect our public health actions here in Utah. So the first change we're doing today is that we're recommending people who have symptoms, they really should stay home, act as if they have COVID, and not necessarily need to go get testing. The second change is that we're putting tests on hold under advisement with Governor Cox, Speaker Wilson, and President Adams. So first, I want to address, how can we make these changes? I think Governor Cox already gave us some information, but you've heard for 2 years that we keep on telling people, go get testing, go get testing. How can we suddenly say it's not as important to get testing? And it is. It's a lot what Governor Cox just told us. There are so many cases going around now. We know if you have symptoms, you most likely have COVID. And so the benefit of getting that test is really decreased. What is more important is keeping you away from other people so you don't transmit it. If you wait to get tested, there's that time where you're going to be able to go to spread it to other people. And really that isn't working right now. So instead of getting tested, instead of going out and exposing more people, we recommend anyone who has symptoms stays home, isolates for 5 days. And we would ask you to act as if you are a confirmed COVID case. You isolate for 5 days. On day 6, if you're feeling better, if you don't have a fever, it's reasonable to go back into society wearing a mask for another 5 days. So what else can we say? Why are we doing this? Governor Cox mentioned it really well. We have limited testing capacity. We have stretched so far. We've done everything we can to increase what we can do to test, and still there's more people needing to be tested. We know there's huge lines. And so what we want to do is use our testing capacity to maximize what we need to do. There's certain groups of people who it's more valuable to test than the general population. So that's why we're recommending most people to stay home, isolate, even if they aren't able to go get a test. So one thing we want to point out is who should get a test. And so there's certain people who should still definitely go get those tests. And those are people who have significant underlying conditions. So right now, our treatment options in Utah are quite limited. It's limited in the entire US. Unfortunately, Omicron has taken out a few of the medications, the monoclonal antibodies that we were able to treat Delta with. Right now, we don't have those because Omicron is resistant to those. But there is still a value. If you have significant underlying conditions, if you're elderly, we do recommend you still go get tested so that you can understand what your risk is. Maybe you will have some treatments. And maybe you don't have COVID. Maybe you have something else, and it would be good for you to know so your doctor can get other treatments for you. Also, we recommend people who are working with vulnerable populations still go get testing. And that's because we do not want those people exposed. We want to make sure that our elderly, people in long-term care facilities, that hospitals are not spreading COVID around. So people who work with vulnerable populations, who work in healthcare, who work in long-term care facilities, we still encourage them strongly to go get testing. And then we also encourage people who are going to visit vulnerable individuals to get testing. We certainly, if you're going to go see your grandmother, if you're going to go see someone who's on chemotherapy, we want to make sure you don't accidentally take COVID to them. And therefore, those are the kind of people we would also recommend testing for. And last, there is a reason if you are someone who's been symptomatic, you're getting better, you're thinking about going back into the community, that's a time where maybe it is reasonable to go get a test. But I want to repeat, if you're symptomatic, we encourage you to assume you have COVID. It is so common right now. It's very likely that you do. And it's not necessary for you to get tested. And instead, stay home, isolate for 5 days, act as if you are, in fact, COVID positive. So that's what we're recommending for the general population. But as I mentioned, we're also changing what our approach is right now for test to stay. And this is a temporary change. The legislature is going to be evaluating this more thoroughly next week. But for now, we're putting test to stay on hold. And for those of people who aren't so familiar with what to test to stay is, it's the school approach where when a school hits a certain number of cases, we do a testing of everyone in the school. So as Governor Cox said, right now that doesn't work so well because we hit that number of cases in the school and we realize when we do that test to stay, a huge number of kids in the school are already positive. The idea is that we did that event to stop the spread, but actually we're behind the ball. For example, in Davis, we had schools yesterday test with 250 kids turn out positive. That means we're doing it too late. And so test to stay really isn't doing what we need it to do. We wanted it to stop the spread. It's behind, it's not able to stop the spread. So for that reason, for the next few days, we're putting a pause on test to stay. The legislature will be looking at what to do starting next week about what to do going forward. There has been the option opened up that now schools can do a 4-day remote learning to be able to sort of counteract some of this spread. So we local health departments, everyone will be working together to evaluate what a school can do when they are seeing more cases to be able to prevent that spread. And then last, I do want to mention that we are reaching out to groups that are holding events or businesses that have requirements that people test in order to come to their event or to work. Right now, the Utah Department of Health, in fact, the entire system doesn't really have the capacity to do those mass testings and mass screenings. And so we are asking those organizations to reevaluate what they're doing in terms of their approach to prevent infection. We recognize it's really useful to test people to make sure you don't have spread in your event, but right now that's very difficult. So we encourage people to look at their event. Is it something that could be delayed? Can a business turn to remote work? Are there other precautions that can be put in place while we're not able to do that testing? Some places have been able to get their own testing resources. For example, the Jazz are doing their own testing. If that's possible, we encourage that. But as of right now, the Department of Health and the state resources aren't able to support that level of mass testing. And then the last thing for those businesses or events, I think the important thing is to encourage what we all are encouraging everyone, is that if you have symptoms, you shouldn't come to that event. You shouldn't come to that business. You should stay home and wait until you're better. So with that, I'm going to turn this over to Superintendent Dixon so she can talk more about what's happening in our schools right now.
Thank you, Dr. Nolan, and good morning, everybody. I first want to start by thanking the adults who work in our public education system. They have done a yeoman's job of trying to keep all of our students learning in person, which is optimal. We see you, we hear you, we know you're physically and mentally exhausted, and we're so appreciative of all the adaptation that has occurred to ensure that our students can stay in school. So I want to spend a little bit of time doubling down on remarks of the governor and of Dr. Nolan and talk about what we're seeing on the ground and then how these actions will help us. You've already heard about the increase in cases in our schools, and it happens so quickly. Consequently, we've been running into operational challenges, and as more and more students and educators and staff have had to stay home to either recover from COVID or they've been exposed. Recently, one school district in Utah saw nearly 1 out of every 6 of its full-time employees absent for health or other reasons. This led to long delays at some of the district's bus routes and a depletion of the availability of substitute teachers. We ended up with classes in gymnasiums, teachers combining 2 or 3 classes together, and therefore just really not only putting stress on the system, but not creating conditions of optimal learning. Another school district reported significant student and staff absenteeism due to a spike to the point where they only had about a quarter of their students in attendance. So as you've heard from Dr. Nolan, test to stay events this week have experienced rates that nearly up to 1 in 7 of the total school population have tested positive. So unfortunately, these numbers, as you've heard, continue to be on the rise, and action needs to be taken to ensure that our schools remain safe and functional. So these actions will help in that one of our primary goals, of course, is to keep our students safe, provide healthy schools. And when schools experience these high COVID cases and transmission, creates situations where they can no longer really learn, we need to do something to get back on track as quickly as possible. This stresses our families, it stresses our economy when our students are out of school, and it's hard on our teachers and our students. Utah's invested an enormous amount of money in digital teaching and learning. We're so grateful to be leaders in this field by the investment of our legislature. And so we do have sources for remote instruction to prepare our students and be able to respond in a very nimble manner to the pandemic. It's not something we want to do in a permanent way, of course, but we do have tools available to put out into our homes and to be able to interact with their teachers during these very brief periods of remote learning. We believe that by giving schools and staff a chance to pause and reset, as one school district put it, we can slow the transmission and we'll be able to get our students back to their classrooms for higher quality education in a safe and healthy environment. Thank you.
Thank you, Superintendent, for all you do. It's good to be with you today under these trying circumstances, everyone. Just want to maybe reiterate what has been said and share some perspective from the President Adams and myself. We appreciate working with all of these great state leaders. This pandemic has proven to be anything but predictable. And we all recognize that we need to be very flexible and adaptable as we move through this current wave. And as the governor so articulately described, this wave has looked a lot different than its predecessors over the last 22 months. It's spreading rapidly, and it's infecting or affecting nearly every Utahn right now. With that, the pivot that's been described today, we think is the right approach and the right strategy to deal with this over the next month or two as we deal with this Omicron version of COVID. And I just want to reiterate what Dr. Nolan said. If you have symptoms, just assume that you have COVID and stay home for 5 days and then mask up after that for the following 5 days. And please, please save the tests for those at-risk individuals that Dr. Nolan has described, or those that are proximate to at-risk individuals. And if you are one of those, we do encourage you to go out and get a test and make sure that you're taking good care of yourself. Also, as has been described, we've been working over the last couple of days, and we've announced that the Test to Stay program has been paused, and the legislature has worked hard to put that in place, and it worked really well to get our kids in school and keep them in school safely over the course of the last 22 months. But we will, as a legislature, be looking at what to do with that program and working closely with Dr. Nolan, Governor Cox, and others to figure out what the right path forward is with Test to Stay. Government, as we all know, doesn't get to decide how pandemics behave and how they spread across our state and across the world. And we're trying to be as nimble as possible in order to address the current needs of the state of Utah. And trust me, none of us want to be here talking about COVID or viruses or masks or tests ever again, but it is the time we still need to be doing that. So the legislature starts next Tuesday. And as we get to doing the people's work, we aren't really sure how Omicron is going to affect our ability to conduct the legislative session. But you should know that we are absolutely committed to doing the work of the people of the state of Utah. And we also recognize that we may have to make some adjustments along the way as we navigate this. Like the governor, I'm hopeful that this peak this virus is about to peak here in the state of Utah, and that we see a decline in cases shortly. And I just would reiterate what's also been said, which is ask each of us to do our part to make sure that we're helping with that. Lastly, and this is probably the most important thing, at least from my perspective, I would be remiss if I didn't thank all the heroes that have been helping the state over the last couple of years during this pandemic. Our healthcare workers, our teachers, the parents, the students that have had very disrupted learning over the last 2 years, and the frontline workers. Their incredible adaptability and unwavering resiliency over this pandemic has really made a big difference for everyone in our state. And while it may not feel this way right now, I'm confident that brighter days are ahead and soon. So thank you.
Thank you. Appreciate the participation here. We will have some time for a few questions and invite Governor Cox to come and answer those. And you can ask to anyone up here if you'd like. Thank you.
Thank you, Lieutenant Governor. Questions? Seeing none.
What do you say to people about masks when there's been such a strange discord about it in different counties, and even among you, some are wearing them, some are not?
Sure.
What would you say to Utahns about mask wearing over the next while?
Yeah, I would say the same thing I've been saying for the last year, and that is that, well, again, this virus has changed. I already mentioned that, and that exponential change is hard for people to understand. What we do know for sure, and there is now broad agreement, is that against Omicron, and it's so hard to change our mindset from previous variants. It's not that we changed, it's that the virus changed. So what we know is that cloth masks do not work at all. I saw one national expert who said they're window dressing. So a cloth mask doesn't do anything. Most experts now are looking at the disposable surgical masks, saying we're against Omicron. They probably don't work as well as they did against past variants for the reasons I already mentioned. So again, we're shedding millions more higher viral load than we were before. What masks do is they limit the distance at which our aerosols and our breath really spreads, right? And we're shedding those viruses, so we're trying to limit the amount of that. But when you have millions times and it stays in the air, a new study just said for approximately 20 minutes, that's out there, even with a mask. And so surgical masks, as unfortunately we're seeing with our healthcare workers who are very good at wearing surgical masks all day and are still getting infected, probably aren't as effective either. That's why the recommendation right now is for N95 masks. And even before public health officials were recommending N95 masks, I believe that they are the only way to help limit spread, especially with Omicron. And even then, it depends on how you wear them. So this idea that we wear masks and we go into a restaurant and then we take our masks off and we eat and drink and somehow the virus knows not to infect us during those times, that's not a thing. Every time you're in a room and you see somebody kind of pull down their mask to kind of catch their breath, now we have viral spread, and again, the most contagious virus that we've seen in our lifetimes. And so what I would say is, again, we all have to make these calculations. If you are vaxxed and you are boosted and you're a healthy person, you make a decision based on that information. If you are at risk, or you are around people that are at risk, and by the way, the most at-risk people right now are those who are not vaccinated, then an N95 mask could make a significant difference and really help you. And so that's my message. I know it's confusing when we hear, well, the things keep changing, and they're right. The virus keeps changing, and that's hard for us to keep up with. But that's what we know, that these work. They don't have as much effectiveness against as they did against prior variants, but they might do something. Other questions? Okay. Well, thank you so much for joining us today. Thank you for getting this information out. I just want to say this to end. Ladies and gentlemen, we are about to enter the endemic phase of this pandemic. It will stop being a pandemic. It will start being endemic. There is something very cruel about this crisis that we have been through over the last 2 years, and it is this. I was reading a book just a couple of days ago by the author David Brooks, and in it he just mentions in a couple lines. This was before the pandemic, but the beauty of a crisis is that it brings people together. There is only one type of crisis that doesn't bring people together, and that's a pandemic. In that, the very nature of it requires us to survive, to stay apart from each other. And human beings, especially in times of crisis, need proximity. We need to be close to each other. We need to come together. And this cruel virus has prevented us from doing that in ways that we've done that in the past. And that has caused immense strain on so many people: psychological strain, traumatic strain, and of course, the physical strain for those families who have been impacted. There will be people hospitalized. There will be people die from Omicron, even though it's milder and even though we have all these tools. There will be people whose lives are impacted forever because of this. We need more than ever to come together, and we have to find ways to connect. We have to give grace for people. People are reacting differently. We fall into our tribes. We're back again having these alpha fights in an Omicron world. We're still fighting about masks. We're still fighting about all of these things. And I think most Utahns are tired of it. I think most Utahns understand that need for proximity, that need for care, and that need for love. And that is where we are headed. I am more optimistic than I have been at any point in this pandemic, that with Omicron spreading so rapidly, that will help us move on, that will give us the type of immunity that we've needed all along to get us through this, combined with vaccines, and that we will be able, after this, in the next couple weeks, as those numbers come down significantly, to return to normal. And I hope that each of us will come back together to forgive each other, to care for each other, and to move forward. Utah is an incredible place. We're doing well, and we're going to be doing even better moving forward. So thank you for coming today. Good luck over the next few weeks, and we appreciate the legislature. We're holding on to our seats for the next 45 days. Thanks, everyone.